Good morning. You're listening to Insurance Matchmaking, the show centered around health and life insurance issues, especially Medicare coverage. This is Insurance Matchmaking with Matt Libby Insurance.
Welcome back to Insurance Matchmaking. I almost missed out on getting here today. I don't know where my mind was, but fortunately for modern technology and the calendar app on my phone goes, hey, you need to be somewhere in 10 minutes. So fortunately, I was able to make it over here and get this show recorded and get news out to you. One of the things I wanted to touch on, I've always said, hey, don't call those 800 numbers. You're just going to get somebody. They're just going to try to switch your plan. And the reason I bring that up is I've recently have taken on a lead source where I'm actually one of those guys, just to kind of expand on my business, that I can get business in other states. And kind of part of the growth plan of my office of if I'm going to add agents, I have to be able to provide sources for them to write business to, because it doesn't do me any good to especially be paying an agent and they never have an opportunity to write any business. And so it's kind of a training ground for me to get proficient at this and then hire agents to just be working those call-in requests. And what they're calling in about, you've probably seen the commercials, and they get stuff in their mailer, things pop up on their phone, and so they hit the button to call to get more information, and the computer connects them to an agent, whether it's me or somebody else. It's a really neat system if you're ever looking in for a way to get inbound calls. But most of the people that are calling, they're looking for the food cards that have been advertised. And those food cards are great on the plans that have them. But what a lot of people don't realize when they're calling in on that is they're needing to make a change to a Medicare plan if they're going to get that benefit. So when they call in, they say, well, they just want to get the food card. Well, the food card is a benefit of a Medicare Advantage plan. It's not provided by Medicare, for one thing. It's provided by the insurance company that they've added that to their Medicare Advantage plan. And not every plan has it. Not every company has it. Generally, most of the time, the food cards are going to be for those that are either generally the lower income, and usually those, and most of them are going to be on what we call the special needs plans. You're also on Medicaid, and in our case here, TennCare. And so then you would qualify for a plan that also adds in the food card. They want people to use the food card to get food, get vegetables, and healthy eating, but it's not really managed. And a lot of the companies it's all encompassed in their extra benefits, whether it's their vision benefits allowance or dental allowance or over-the-counter allowance. It can all be tied to that one card. And some of them, it's just a membership card. Some companies will issue a debit card that gets charged for certain accounts. And the thing is, when you go to the store, and I've used names because it could be Walmart, Kroger, Walgreens, CVS, stores like that. In fact, even maybe Dollar General. And it works, and if anybody's used the EBT cards, which is the food stamps, it's only going to pay for certain items. Using the food card example, you get some AA batteries. It's not going to pay for them because they don't fall into the over-the-counter category. But it may pay for Band-Aids because that would use the over-the-counter allowance. And sometimes it's a combined allowance, whether you use it for food or whether you use it for the over-the-counter items like aspirin, vitamins, cold remedies, a bunch of those things. And that's one of the things that's neat about the Medicare Advantage plans. You don't get any of those benefits if you have original Medicare with a Medicare supplement like a Plan G or Plan F, Plan N. So you're not going to get those extra benefits without changing your plan. So I'm just kind of putting that out. One, I always say, don't call the 800 number. You've got a local person here that you can reach out to. And I'm not the only guy in town doing this. And I say guy, I'm not the only one in town that does this. There are ladies and gentlemen who are licensed like myself, and I'm sure they do great service also and take care of their clients. So if you're not going to call me, call somebody else that's local. One, we know the market here. We know what doctors, if they have a preference, a lot of times it's like, this doctor is not going to take this plan. I don't care if it is a PPO. They're not going to accept that plan for any partial payment. If you want to go to that doctor, you need a plan that's in network. So those are the things that I can kind of help with that. And just kind of put that out there of anytime you're calling for additional benefits when it comes to Medicare, there's no way to get the additional benefits without changing your plan. And it could even be the same company. It may just be a matter of, because a lot of them have been doing what we call the give back plans. And the give back plans are great for some people. not so great for others. And it really depends. Because one of the things is anytime they give you more benefits in one area, they're going to take it back in another. So big example is a lot of the plans, because of some of the drug cost changes, some of the plans have dropped their dental or lowered it, or some have dropped the over-the-counter benefit. So a lot of those things will change. So if you're having a give-back plan, the great thing about the give-back, it puts money in your pocket. Whether you're not drawing Social Security yet and you're paying that monthly premium for your Part B of Medicare, which currently is $185, there are plans out there that they'll pay $40. So you only have to come up with $145 to pay. So again, it puts $40 back in your pocket, whether you're having to pay it or it raises your Social Security check, that $40 or $100 or $140. It really, the plans differ. Now, one of the great things with the Give Back plan is, like I said, you're saving on that $185. Now, you are going to run into issues with, say you have to have an outpatient surgery or you're admitted in the hospital. Those things are going to cost more. The copays are going to be higher for those big ticket items, as we say. The maximum out of pocket on your plan is going to be higher. There are plans out there. They're still, $3,000, $4,000, $5,000 max out of pocket. They can be all the way up to $9,250. So, and that's generally what happens is if there is a give back, you're probably looking at $6,700 or $8,000 max out of pocket, because they're going to make it up somewhere that, hey, if we're paying your monthly premium and you have a couple of bouts during the year of a hospital stay, they're going to cover it, but you're going to have a little bit more out of pocket to pitch in on that. So those are some of the trade-offs with that. But what we run into, and I did some math just yesterday, I was actually kind of surprised. Since I've been doing my Welcome to Medicare workshops, I was writing a lot more of the Medicare supplement plans. I've been doing we call T65. Those that are turning 65, they're going on to Medicare for the first time. I help them make that decision of, do I go the old traditional route with the original Medicare, pay monthly for my supplement, pay separate for my drug plan, pay extra to get dental and vision because Medicare does not cover routine dental, vision, or hearing benefits? You do get those with the Medicare Advantage. You don't get those with the supplement. And as I mentioned many times, Medicare supplement, you pay for coverage. Medicare Advantage, you pay as you go. Now, if you're only going to the doctor a couple times a year for a routine checkup, or like I have to do every 3 months, do my blood work and get my refills, and that's pretty much covered. That's not going to cost anything, whether you have original Medicare or whether you have Medicare Advantage, because most your primary doctors is going to be a zero copay on most plans. So there's not a lot of expense there. So a Medicare Advantage makes a lot of sense. And when you're turning 65, and I can feel it. It's like I'm 66 now, and now it's like I thought I was still relatively healthy, and now I'm starting to feel that, yes, I am getting older. So a lot of folks that are still working when they're turning 65, and even some that are staying on and working a little longer till they get to full retirement age for Social Security, most of the time, because they're still in their active ages, as we'd say, are relatively healthy, hardly ever go to the doctor, don't feel they need to be paying for that coverage, that you don't have to worry about networks and such with the Medicare supplement. Before I started that I did math, and I'd been telling people, oh yeah, I'm doing about half and half, about 50% Medicare supplement, 50% Medicare Advantage. The national average has actually gone, Medicare Advantage has actually creeped up to, I think it's like 52%. This is the first time that more people signing up for Medicare or signing up for Advantage plans than for Medicare supplement. But just my own surveys, people turning 65, it was actually 25% of my most recent enrollees went with the traditional Medicare and Medicare supplement. Most people, they're value-based. They're looking at, well, I can get a Medicare Advantage, don't have to pay anything, premium, go to the doctor a couple times a year, might have a copay here or there, but I'm saving several $100s a month, saving a couple $1,000s a year by not having the Medicare supplement. Now, there is a downside to that also, is when you first go on Medicare, there are no health questions for a Medicare supplement. The first 6 months, you turn 65, you just sign up. There's no health questions, no problem on that Medicare supplement. After that 6 months, you decide you want to get a Medicare supplement, then you could have to fill out the health question. You don't have to have a physical. No one's going to come. You don't have to go to the doctor's office. No nurse is going to come to the house and take your blood or anything like that. It's just a matter of filling out the form and saying, no, I haven't had cancer. No, no, I don't smoke. This is how tall I am and how much I weigh. All those little questions like that. And some of those things could be knockout. Height and weight could be a knockout. Diabetes is a knockout on a lot of plans. So there's a lot of things that could prevent you from being able to get a Medicare supplement if you decide to wait to get it later. And that's what I always caution everyone on is if you don't get a Medicare supplement when you first turn 65, you may not be able to get it when you're 67 or 75. Now, the other downside there is those Medicare supplement premiums will go up every year. So you're already paying more and you feel like you're not using your benefits. And after the break, I'm going to come back with some of the solutions on that. And it's something that I've talked about before. I'm just going to kind of reiterate it, kind of reviewed on it yesterday. So I did want to touch that. So we're going to go ahead and take the break here, and then we'll be right back after the commercials.
Let's go to Nashville Shores. Go splash, go together to Nashville's biggest water park just 10 miles from downtown Nashville. With over 20 exciting attractions, including 10 water slides, a giant wave pool, relaxing lazy river, lake activities, and endless family-friendly fun. There's something for everyone. Save time and skip the line. For the best deal, buy online and save up to $20 on daily admission. From thrilling water slides to relaxing lake views, it's the ultimate summer getaway. Visit NashvilleShores.com today. Nashville Shores. Let's go.
This summer, why travel for paradise when you can create it at home? With summer space awnings, screen systems, and porch enclosures from Willow Window, you can turn your backyard into the ultimate escape. Stylish, durable, effortless. Whether you're hosting friends or savoring quiet evenings, Summer Space lets you live your best outdoor life right at home. Schedule your free consultation at Willow Window today and take your outdoor sanctuary to new heights. 931-WINDOW-1.
Got items you no longer need? Give them a new life at the Restore Donation Pop-Up Event. Saturday, June 14th from 10 a.m. to 12 p.m. at First National Bank in Sparta. Drop off your gently used items and support a great cause. Their donation truck will be there ready to go to receive your donations. And guess what? They'll be back every second Saturday of the month, so don't miss an opportunity to declutter and make a difference. June 14th, 10 until 2 at the First National Bank in Sparta with the Restore Donation Pop-Up Event.
And now, back to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance, hosted by Matt Libby.
All right, and we are back after those commercials, and I mentioned I was going to talk about how to protect yourself on those gaps. And I don't know, I've talked about this before, and I try not to do just pitch products every time I'm here, because you might stop listening because you think I'm just trying to sell you something every time. But one of the things that you can protect yourself for a lot less expense is what we call the hospital indemnity plans. Or, of course, the shorthand we like to use is HIP. We like those acronyms, which fits out great for me with, years in the military. Everything was an acronym. We pulled CQ duty and didn't go AWOL and all those good stuff that we used, all those acronyms. But the way a hospital indemnity plan works is it's a reimbursement. And we have plans like that for people who are under 65 also, not just the Medicare Advantage. The plan I was working with a client yesterday on was we can customize it. And that's one of the things I do is I'll customize those plans for my clients, especially if they're considering a Medicare Advantage, because my concern is you get the Medicare Advantage because it's a lot less money, but a few years down the road, you start having some health issues. You can't get that Medicare supplement that's going to cover everything after your deductible. You're going to have all those big copays. You're going to pay for that surgery. You're going to pay for those days in the hospital, which you didn't prepay with having original Medicare and a supplement. So very inexpensive. You can get a hospital indemnity plan and even possibly a cancer plan that will pay you $10,000 all the way up to $75,000 are the plans that I'm marketing this way. And again, the neat thing with those plans is the rates do not go up as you get older. A Medicare supplement is going to go up as you get older. Your Medicare Part B premium is going to go up. Generally goes up every year. Just remember, if you're getting a raise in Social Security, your Medicare costs are going up. It's going to happen. That's the way the government does things. Is it really a raise? I don't know. It seems like whatever you get in a raise, you just give back to Medicare anyway. But the hospital indemnity plans, the lump sum cancer plans that we recommend, they don't go up. You're paying based on your age when you get it. And that's why a lot of times it makes a lot of sense when you're talking to someone that will be 65 when they go on Medicare, but you can actually save a little bit on your monthly premium by getting it while you're still 64. You're paying rate for 64. It's going to go up a few percentage on the cost when you're 65 if you get it at 65 instead of 64. So it makes sense to go ahead and get it put in place before you have that next birthday. That being said, even with a hospital indemnity and a cancer plan, very easily under $100. The way I customize it for my clients, it's usually about $45 to $50 a month. And again, $30 to $45 for a cancer plan. And that's why I'm saying you could be under $100. That's less than you're generally going to pay for a Plan G Medicare supplement. And your Advantage plan is also including your drug coverage, because you don't want to go without drug coverage and then face that late enrollment penalty for Part D if you wait because you're not taking any meds. So if you decide to get a zero premium Advantage plan, or, and this is one of those cases I was talking about in the beginning about those give back plans. If you've got a hospital indemnity plan that's going to reimburse you for your hospital stay, it's not going to bug you that much that maybe there's a $375 per day charge for the hospital. But if you get a reimbursement for $400 per day, you're coming out $25 a head, and maybe you're getting a $100 Part B give back and you're spending less than $100 on your indemnity and a cancer plan. You're using that Part B give back to pay for, protect you against those other costs. Now, you may switch in another year and not have the Part B give back and have a plan that has lower max out of pocket, lower co-pays. But again, that indemnity plan, and that indemnity is a big word. It means the insurance company is going to pay you. You don't have a card that you present to the doctor, and now you don't have a copay. It doesn't work that way. It is a reimbursement plan. But the great news there is whatever rate you set that it's going to pay. Example, the other one was the plan that I wrote for this client this week was it's a $50 reimbursement for going to the urgent care. All the plans want you to go to urgent care if you can, that after-hours clinic. You don't have to go to your primary doctor, or maybe at 6 o'clock and you just got off work, your doctor's closed. But it's not, you need to see a doctor, but it's not an emergency. Go to the urgent care. It's going to cost a lot less money. Even if you don't have insurance, it's maybe going to cost you $150. You go to the emergency room and they can charge you $1,000 or more. So if it's not an emergency, go to the urgent care. Because when you go to the urgent care and they feel it's an emergency, they're going to say, we can't help you here. Go to the emergency room. Or sometimes they'll even call 911 and get the ambulance to come get you from their facility. They're not going to try to treat you if it's truly an emergency. Think you're having a heart attack, you're bleeding profusely, things like that. Yeah, you just need to go to the emergency room. You don't feel good, you twisted your ankle, even if you think you broke your ankle, they can do x-rays. And again, if they can't help you at the urgent care, they'll send you to the emergency room. So that'll save you a lot of cost. Anyway, I was saying, one of the plans out there, their copay for urgent care is $25. That's less than their copay for a specialist. So with that being said, you're actually going to make $25 for going to the urgent care. It'll cover $200 for the emergency room. Most plans right now, the emergency room copay is $125. Now, again, as you get older, those emergency room copays go up. I was really surprised. When I first started, every year it seemed like the emergency room copay went up. I think when I started it was $60, and then the next year it was $65, and then it was $75, and then it was $90, and it was $90 on all plans for several years. I was really kind of surprised how long it stayed at $90, and now most of the plans are charging $125 for an emergency room copay. So those copays will go up. So 10 years from now, they probably will be over $200 copay for the emergency room. So you're going to get reimbursed $200 of it, but it may not cover it all, but it's going to take a good chunk out of that bill. The same thing with the daily in the hospital copays. Maybe you get the plan now for $300. It'll pay $300 per day that you're in the hospital. Reimburses for the same amount that you're paying in a copay. If 10 years from now your copay is $400 a day, well, you're going to spend $100 a day for the hospital. That's not a terrible copay. But the beauty, again, as I said on those plans, is they don't go up because you had another birthday. And I always have to kind of qualify it as they don't go up. Now, there will be in the small print, company will say we reserve the right to increase rates. Any of the plans that I'm working with, since I've been doing this, and some of them can even say they've never raised the premiums on the plans. Now, I have had some people that I've sold some plans to that could say, oh, they're not going to go up. They don't go up. And they've gone up some, but it was like a one-time thing. Some of the dental plans right now are raising their premiums. I'm a firm believer if you're going to raise your rates, raise the rate for new people. Don't raise it on the people who have been paying you every year, for 5 years or more. You should be grandfathered into your rate statement. But they do reserve the right to raise their rates. But generally, it's not much. It's not like health plans that go up every year. It's not like your car insurance or homeowners insurance that generally goes up every year. Most of these plans are going to stay the same when you lock them in. I do have one plan that's different. I've talked about it, I think, just a couple of weeks ago, the home health plans. Now, they do go up as you hit a certain age bracket. So like every 5 years, you have a rate increase. But again, we can show you what that rate increase is going to be. It'll be a surprise in 5 years because you forgot it was going to go up. But it isn't a complete surprise. We can actually plan for, okay, it's going to be $25 more a month when you turn 70, or when you turn 71. I can't remember now, but it's every 5 years. So it's either, like 65 to 70 is one rate, 71 to 75 is another rate. And I think at 80 or 85, they don't raise anymore. So whether you're 84 or you're 95 or 96, now you're paying the same rate. So those can come in handy. And again, those work great for helping out when you're homebound. Now, they have those triggers. Talked about that as one I know I talked about a couple of weeks ago. It's based on the activities of daily living. But they can also, those activities of daily living could be temporary. And that's what's great about these plans. A lot of the benefits will go ahead and reset. You can have 300 days worth of benefits because they're really kind of designed to bridge from you're trying to stay in your home as long as you can and bridge that gap because if you have long-term care insurance, a lot of them have elimination periods that you have to be needing extra help for 6 months or 90 days or even a year. And that's where these plans can be very handy. They're much more affordable. They're also, what's great is they are guaranteed issue because unfortunately, if you didn't get long-term care when you were young and healthy, you may not be able to get it now. These plans you can get, they do have some waiting periods for pre-existing conditions, but they're virtually guaranteed issue. There are a couple health questions, and the biggest ones are you're already receiving care or you have already been diagnosed with memory issues. Once that happens, you can't get the plan. But you don't have to be in the best of health. They don't have height and weight questions. They don't ask smoking questions. They don't ask health questions at all other than those few that would be a knockout. That, you're in a wheelchair, you're in a nursing home, you've been diagnosed with dementia. Those are the kind of things that would go against you. And if you're listening to this show and understanding what I'm saying, you probably qualify. So, give that some thought. It doesn't matter if you had a heart attack, 6 months ago, or if you had a stroke, you can still get these plans. Something happens in that first 6 months, it may not cover, but it will cover after that. And I also mentioned the neat thing on these plans is they have a reimbursement rebate program in with your prescriptions. And if you take a lot of prescriptions, the fact that you're taking those prescriptions can pay most of your monthly premium. That's those home health plans. But the hospital indemnity and the lump sum cancer plans, I recommend to anybody who's doing a Medicare Advantage. I mean, everybody loves zero, but the problem with zero is something happens, you're going to have some big out-of-pocket costs. And we can kind of help hedge that off. And one of the big things, outpatient surgery, it'll cover that. And those are usually pretty good-sized co-pays, some $200 to $350, depending on the plan you have. Again, if you have that Part B give back, it's only going to be $350. Cataracts are very common when you're over 65. And that surgery is done as an outpatient surgery. And it's going to be 2 surgeries. You don't go and have both eyes worked on because then you'd be blind for, several days. They'll do one eye, you go back, and once that eye is healed a couple of weeks later, you go back and have the other eye done, and then you're done. Well, those are 2 separate surgeries, and you can have up to 4 surgeries in a year that the reimbursement will come into play. So that right there can save you a bunch of money and doesn't cost you that much to get the plan to have that in place. So those are great. And even if you're not my client, but you don't have to have Medicare. You don't have to have a Medicare Advantage. You can be under 65 and have this to supplement your, employer insurance. That's something we can look at. So, give me a call and let me see if I can help you out with that. And as always, remember at Matt Libby Insurance, we can cover you from head to toe. It doesn't have to cost you an arm and a leg. Please go to insurancematchmaking.com. Leave comments for the show. Also, you can access the YouTube, the past recordings there. send suggestions of what you'd like to talk about or suggestions of people you think would be a great addition to me interviewing on my show. So until next week, stay tuned. I'm enjoying this new format of Grace 1077, and hopefully I'm getting some different listeners here. Talk to you next week.
Thanks for tuning in to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance.